Good evening. Welcome to the Eastern Ontario Health Unit's Ask Dr. Paul Facebook Live event. Dr. Paul Remiliotis, Medical Officer of Health, is on live again to answer your questions related to back to school. Bonsoir, bienvenue à l'émission du Bureau de santé de l'Est de l'Ontario, Dr. Paul à l'écoute sur Facebook Live. Le Dr. Paul Remiliotis, médecin hygiéniste, est là en direct encore une fois pour répondre à vos questions sur le retour à l'école. My name is Chantal and I'll be your moderator. Participants watching can submit their questions in the comment box. We will try to address as many questions as possible. However, we will give priority to questions from the public that are directly related to tonight's theme. We do reserve the right to remove any comments that are abusive or include profanity. Je m'appelle Chantal et je suis la modératrice. Les participants présents peuvent poser leurs questions dans la boîte de commentaires. Nous allons tenter de répondre au plus de questions possibles. Cependant, la priorité sera donnée aux questions associées directement au thème, choisies et posées par les membres du public. Nous nous réservons le droit de supprimer tout commentaire abusif, incluant la profanité. We will now begin. Nous allons maintenant commencer. Good evening. Bonsoir, Dr. Paul.
Good evening, everyone. Thank you very much, Chantal, and bonsoir tout le monde. We're going to start with our questions very soon. I just want to remind people that we'll do our best to answer as many questions as we can. And if we can't answer them, either I'll answer them the following week, or we will email you or put them on our Facebook page. I want to thank people for all the questions that they've sent. They're great. A lot of them we're actually incorporating on our website, so keep them coming. And like I said, if we can't answer them tonight, we're going to do our best to answer them in the very near future. Speaking of which, I know I had a question about music class that I didn't complete last week. I did not forget it. We are looking at some of those music masks that you talked about, and I will get back to you either next week, but likely in the we'll email you. Donc, bonsoir tout le monde et bienvenue ce soir. Je vous remercie pour toutes les questions que vous avez envoyées. Nous allons faire le plus qu'on pourrait possible de répondre à vos questions. Si on n'a pas le temps ou si on n'a pas la réponse tout de suite, c'est sûr et certain qu'on va retourner soit la semaine prochaine ou on va vous contacter via Facebook ou d'autres façons. Aussi, je vous prie de continuer à envoyer les questions parce que souvent, c'est les bonnes questions et on les utilise sur nos sites web dans la section des questions demandées fréquemment. Donc, on va commencer. So, without further ado, let's start with the questions. Chantal.
Great. Thanks, Dr. Paul. So we're going to dive right in with a question from last week's session, and it's related to school transportation. Donc, on va commencer la session avec une question concernant le transport scolaire. So will the health unit be asking school transportation authorities to implement further or better transportation plans? So, for example, having assigned seating, separating bus routes by schools, or mandating that windows remain open, and more?
Yes, that's a very good question. As a matter of fact, there are very strict guidelines for transportation in buses. And so, yes, we have actually worked with our school board and the transportation authority in terms of what the recommendations are, what we would want. And yes, we would want, first of all, we'd want the kids to be assigned to specific seats all the time so we can track who they're sitting with. We are highly recommending masks. And obviously, we are recommending windows to be open as much as possible. Going into the winter months, you can imagine that's not a good possibility. However, those are guidelines that we've given to them, and we're working through our transport authorities and our school boards to be able to achieve that. Donc en français, je vais répéter la question. C'est en effet, qu'est-ce qu'on fait avec les autobus des écoles? En effet, nous avons des guidances qui est très spécifique pour les autobus. Premièrement, nous voudrons, et c'est ça qu'ils font, les enfants vont s'asseoir sur les places réservées tout le temps, le même, qu'on pourrait avoir un tracé si on a besoin. Les enfants ont fortement recommandé de porter des masques lors qu'on est sur l'autobus. Bien sûr, désinfection très fréquemment entre les trajets. Et finalement, l'ouverture des fenêtres est fortement recommandée. Mais on peut comprendre que dans l'hiver, avec la froide, ça ne sera pas possible. I want to add in English, one of the things, of course, obviously frequent disinfection and disinfection between uses, of course.
Great. Thank you, Dr. Paul. So we're going to go to a question from the chat box. It comes from Stephanie Lapense, and it has to do with class sizes. And so she asks, why are classrooms still jam-packed? So for example, how is 25 students in a kindergarten class acceptable? And why aren't smaller classes happening?
This is one thing that we're looking at. We're aware that some schools have had many kids. We have asked them to have the physical distancing. If, for example, they can have 20 kids in a class or 25 with 2-meter distance, that's fine. If not, we will be working with the schools to look at solutions, because I would like to recommend to them that they keep them 2 meters apart. And there are some other ways that we can work with the school. So we're actually, one of the first things we're going to be doing is our nurses are going to be looking at class sizes. I've actually asked for reports of class sizes for each and every one of our schools, so we can then work with those to see what the circumstances are, what the size of the school, of the classroom is, and what we can do to ensure that there's physical distancing. En français, je voulais répéter, c'est plutôt une question au niveau des numéros d'enfants dans une classe. Apparemment, il y a des enfants aux garderies ou aux maternelles qui sont 23 ou 25 dans la classe. Effectivement, nous voudrons, la recommandation que nous avons, c'est d'avoir le chiffre dans la classe qu'on pourrait avoir une distance physique de 2 mètres. Et nous allons, en effet, en travaillant avec toutes les écoles pour identifier les classes qui sont plus que 20-25. À ce moment-là, nos infirmières vont rentrer pour voir exactement. Et j'ai demandé à tous nos 4 commissions scolaires de nous envoyer une liste par école avec le numéro des enfants dans chaque classe. Donc, on va identifier les classes où on pense que les enfants sont trop, et on va voir c'est quoi le contexte. Est-ce que dans la classe, avec même 25 enfants ou 20 enfants, on pourrait avoir une distance physique? Donc, ça, c'est tous les facteurs qu'on va concentrer. Et en effet, on va avoir un rapport de chaque école de nos 4 conseils scolaires.
Great. Thank you, Dr. Paul. So just a bit of a follow-up on that. So we had some outstanding questions from last week that sort of touched on this. And we also have a question in the chat box from Cap Lortz asking, when will the nurses be coming to the schools to check on those class sizes?
As a matter of fact, we just hired them this week. It'll be starting next week. And so we're also going to be doing spots. I will be going personally to a variety of schools. I can't go to all of them, but the schools will be going into there. But even before that, before they even check on how the class is structured and how the kids are separated, we're also getting the reports of right now on paper and identifying priority where we feel there's more kids than we would want to, and that those will be our priority. We'd start with those, obviously. Donc, en français, quand est-ce que nos infirmières vont rentrer aux écoles? En effet, nous avons fini, vraiment, on a engagé la dernière. On est prêt pour aller la semaine prochaine. Mais ils vont faire une inspection, bien sûr, non seulement pour voir les chiffres dans la classe, les numéros d'enfants dans la classe, mais d'autres choses, les précautions qui sont prises. Mais entre-temps, moi, on va recevoir les listes des classes avec le numéro d'enfants dans chaque classe, et on va identifier si on voit une qui est plus que les autres. À ce moment-là, on va faire une priorité d'aller visiter cette école en première. Et aussi, moi, personnellement, avec mon équipe, aussi des gestionnaires, vont faire des tours autour de pour faire des visites aussi, pour en parler avec le personnel, pour voir les classes, etc.
Fantastic. Thank you. So, Dr. Paul, we're going to go back to the transportation question. So we have a bit of a follow-up on this from Heather Buist. She's asking, why have the recommendations not included separating bus routes by schools? And so, for example, if there are multiple schools on one bus, can you speak to how the cohorts are being maintained or how we're limiting contact?
Well, the thing is that ideally, it would be great to have the kids separated. In an ideal situation, it would be great to have each classroom in its own bus, but it's difficult. It's difficult in terms of logistics of the buses. And so what we wanted to do is, the reason we're identifying each child at the same time is that there's only those children that will mix with those cohorts in the bus. And the reason that we're also wearing masks, so we're adding, the kids are all going to be, we hope that we're all wearing masks, certainly the kids in grade 4 and above, but certainly we want all the kids on the bus to wear masks as well, because it's a shorter period of time, and that will add to the protection. But one of the reasons that we want kids to be in the same cohort all the time in the bus is so we can easily trace it. en français. Pourquoi est-ce qu'on a des enfants qui sont mélangés à différentes écoles dans le même autobus? En effet, idéalement, moi, je voudrais que chaque classe a son autobus privé ou dédié, mais ce n'est pas possible. Et surtout dans les régions rurales, on a besoin de mélanger les enfants parce qu'on n'a pas assez des autobus et pas assez des conducteurs aussi. Donc, la raison pour laquelle on insiste que les enfants se siègent aux mêmes places en tout temps dans les autobus, c'est plutôt qu'on pourrait avoir une restriction et aussi d'avoir une idée de avec qui cette personne était en contact. Et aussi, on recommande fortement que tous les enfants dans la classe, dans l'autobus, portent les masques. À ce moment-là, tous les enfants sont protégés aussi. Chantal?
Sorry about that. I was on mute. So we're going to go back to an outstanding question from last week, and it has a little bit to do with, having classrooms that are jam-packed, but also the bringing of equipment back and forth. And so the question is about the safety of having backpacks in the classroom instead of in a designated locker or on a hook out in the hallway. So the person asking the question says, kids are being told they can't bring their notebooks or textbooks back and forth from school, but they can have their backpacks all over the classroom. And they're saying, aren't the bags potentially bringing in germs or creating a tripping hazard in an already packed classroom? And can you provide some clarification on this?
Well, you need to have a balance between bringing them there and leaving them in a locker. We don't want kids to congregate in lockers, so the lockers are not going to be available. So we have to find a compromise. And I think what the compromise is, they will be bringing them in. And obviously, there could be a tripping hazard and it could be bringing in germs. But I also want to say that we now know that the virus transmits itself mostly by aerosol from one person directly to another. It's unlikely that the virus remains viable on plastic or cloth surfaces. However, again, it really is important for people to wash their hands before and using them, before and after carrying the bags and touching the bags. So those should be in place. And again, it's important to understand that if they leave it outside, there's no lockers. We don't want kids to be congregating outside. So that's the reason for that. It's a happy medium. Donc, la question, c'était plutôt pourquoi les enfants n'ont pas le droit d'apporter les livres, etc., dans la classe et de leur maison, mais il peut avoir des knapsacks, comment on dit, les sacoches avec eux. En effet, il faut trouver une balance parce qu'on ne veut pas que les casiers sont utilisés parce que si tous les enfants vont au casier en même temps, ils vont être proches. Donc, il faut avoir une moyenne d'avoir les choses importantes avec l'enfant dans la classe. Donc, à ce moment-là, il pourrait l'apporter. Mais il faut dire aussi qu'on est moins inquiété maintenant qu'un sac en plastique ou en matériel va propager le virus pour longtemps. En effet, nous pensons que ça ne dure pas longtemps sur ce type de matériel, mais quand même, on dit que à chaque fois qu'on touche n'importe quoi, il faut désinfecter les mains avant et après.
Great. We're going to go to a question in the chat box, and this has to do with masking. And so we have Chelsea Lipson, who's asking about why are the school boards asking for a reason for mask exemption when you would have stated in a previous session that they did not need to provide a reason for being exempted from wearing a mask.
We still at this point do not require a medical proof for that. If it's a medical reason, there's a few other reasons. As a matter of fact, we will be having sort of guidelines as to exemptions for masking, but at this point, we're not asking for proof. However, schools may reserve the right to ask if there's a medical condition. I think the schools should know about it, and we say that all the time, even in non-COVID times. So they may be asking for those reasons, but for an exemption, it should be, well, my child can't wear a mask for medical reasons, and that's it. We do not require proof of that exemption. Donc, on n'a pas besoin, au niveau des masques à l'école, pour les exemptions médicales, on n'a pas besoin de preuve médicale pour le faire. Il s'agit que le parent le dise, que mon enfant ne peut pas porter une masque pour plusieurs raisons. Par contre, l'école a le droit à demander, OK, c'est quoi les conditions médicales de votre enfant? Parce que des fois, en effet, on recommande que si votre enfant a un problème médical, c'est mieux que l'école est au courant en cas qu'il y a quelque chose, une urgence arrive ou disons que l'enfant a un problème respiratoire ou d'autres choses. Donc, même si on n'est pas en période de COVID, on recommande fortement que les parents communiquent avec l'école et qui informent l'école de si un enfant a un problème médical, soit que ce soit de l'asthme ou soit que ce soit d'autres problèmes, même comme les allergies alimentaires, etc.
Great. So I have a question that's still outstanding from last week, and you did touch on it a little bit,
Okay.
but we've been getting a lot of questions from folks throughout the week and during the live session, still looking for clarification about what we're supposed to do when one family member or sibling is symptomatic. So does this automatically mean that the sibling can't go to school and that they should also self-isolate? What if the siblings go to different schools? Do the parents have to advise both schools? And then there's also the additional question of, what does a parent have to do? Should they call their employer and let them know? Should they be staying home and self-isolating? So just a bunch of questions around that. And I think it's still, people are trying to figure out how to navigate what happens if they wake up and someone in the family is symptomatic.
So first of all, if a child is symptomatic with any of the symptoms, it doesn't mean that the child has COVID. However, we recommend the child does not go to school. And so if we do not figure out that, for example, if the child has symptoms that are part of his or her chronic conditions, or there's another reason for the symptoms, then at that point, we would have two approaches, either to recommend testing or for the child to stay home for 14 days, which is probably not advisable. So we would recommend testing. We would isolate the child during the time of testing. However, in a low risk situation, and again, this could change if we have high infection rates in our area. In that situation, what we would do is we would not necessarily isolate the siblings or the parents. We would tell them to monitor their symptoms, knowing that the parents, when they go to work and so on, they'll be wearing masks and not exposing others to it. So that's what we'll be doing with those situations where, and then if the test is negative, obviously at that point in time, what we would do is the child can go back to school within 24 hours after symptoms have resolved. So that's how we're going to be doing it. And I realize that there's going to be perhaps kids being sick a lot, and then we'll have to deal with it at that point. But the premise is that, so let's say the parents do not want to get the child tested, then the child will be isolated for 14. Will have to stay home for 14 days, and that's how we're going to be doing it right now. Our life will be much simpler as we get the instant tests. If we have an instant test, we can do it right away and figure out what we're going to do. Donc, je vais répéter en français. La question est si un enfant est malade, disons que l'enfant a un symptôme respiratoire ou comme une grippe ou une rhume. Premièrement, ça ne veut pas dire que l'enfant automatiquement a le COVID. Il y a plusieurs raisons. Si on trouve une raison, disons que l'enfant a fait de l'asthme ou c'est une exacerbation de ses symptômes chroniques, etc., à ce moment-là, on n'aura pas besoin de le tester. L'enfant va rester à la maison tant que les symptômes sont là. Si, disons qu'on va le tester l'enfant, on peut tester l'enfant. En attendant, l'enfant va être isolé à la maison, mais les proches ne seront pas nécessairement sur isolation tant qu'ils pourront se distancer quand ils vont aller travailler, ils vont aller à l'école, porter masque, etc. Si le test est négatif, à ce moment-là, l'enfant pourrait retourner à l'école après 24 heures que les symptômes sont finis. Et par contre, si c'est positif, à ce moment-là, on aura d'autres précautions à prendre. Si les parents ne veulent pas si l'enfant n'est pas testé, à ce moment-là, et surtout quand on est en période de COVID, si on est dans notre région, on va présumer que on va isoler l'enfant pour 14 jours parce qu'on ne pourra pas faire le test. L'idéal serait d'avoir un test instantané qui, à mon avis, on va avoir bientôt, qui va vraiment nous aider beaucoup dans ce sens.
Thank you. We're going to go to another question that's from last week. I think it's very timely, not only with children going back to school, but also with the weather forcing a lot of people to go back outside. So the question was that whether we should be changing our behaviors given that children are back to school and in contact with more people. So would you recommend that families reduce or eliminate the number of people that they're in contact with, including their 10-person social or family bubble?
Certainly outside the bubble, I would definitely recommend it. I can tell you that we've had examples of all the cases that we've been seeing in Ontario right now, and actually across Canada. But let's speak to the Ontario situation. For example, we had, I think, about 170 cases added to that today. Most of them were not because they got it at a restaurant or at a bar. It's because they had parties, they had pool parties, they had wedding receptions, church gatherings, and all kinds of parties where they did not physically distance. So, and they misunderstood the fact that, oh yeah, I can have 50 people at a party because that's the gathering limit, but no, 50 people physical distancing and so on. So that's what's going on. So yes, as a matter of fact, one of the keys for us to be able to maintain schools open is to keep that community level down. So regardless of the fact that right now we have lower levels at this point, although we do have cases in our area, we added 10 over the last week in our area. Despite, even though they're low, don't forget, we're surrounded by pandemic. Quebec is increasing cases. Provinces to our west are increasing cases, and you know what's happening in the United States. So at this point, I would recommend that as much as possible, particularly over the next couple of weeks, that we're getting back into that, that groove and going back home, is that we try as much as possible to limit our contact with our social bubble, our physical bubble itself, and really refrain from going out unnecessarily, particularly if you have elderly at home and those type of things. So I think it's very important that we pay attention to what we do. Again, don't go out unless it's necessary. Don't travel unless it's necessary. If you go to the grocery store, just go one person. Don't go with the whole family. I mean, there's a whole slew of things that we can do. I'm going to say it in French, je vais le dire en français. C'est une bonne question. Qu'est-ce qu'on pourrait faire au niveau des personnes les rassemblements, au niveau de la publique, surtout quand on rentre aux écoles, puis on rentre dans l'intérieur avec le changement de la température. Mais en effet, ça, c'est une question très importante parce que si on voit ce qu'on voit à travers du Canada et surtout en Ontario, la plupart des cas sont les cas qui étaient propagés dans les événements sociaux, pas dans les restaurants, pas dans les bars, c'est des événements sociaux privés, les réceptions de noces dans les églises, dans les parties, dans les chalets où il y avait 10, 12 personnes, etc. Un cas à Ottawa, il y avait une personne qui était malade dans un chalet et 2 semaines après, on avait 40 cas qui ont débuté de celle-là. I'll say in English. In Ottawa, my colleagues have showed us a little diagram where one case started in a weekend chalet visit with about 10, 12 people. 3 people got sick and then spread it to 40 others, including 2 daycares that had outbreaks. So we need to be very careful. Donc, on devrait être vraiment prudent de ne pas, si ce n'est pas nécessaire de voyager, restez chez vous. Si ce n'est pas nécessaire d'aller voir beaucoup de rassemblements, n'hésitez pas de rester chez vous, surtout si vous avez des aînés ou des personnes avec des problèmes chroniques médicaux. Et surtout, si vous allez magasiner, en effet, allez seul, emportez pas les enfants. On voit maintenant que les personnes vont au magasin avec 2, 3 enfants. Ce n'est pas nécessaire. Encore, on est dans une pandémie. On voit autour de nous, à Québec, sud de nous, à New York, aux États, et à Manitoba, toutes les provinces de l'Est commencent à avoir des cas encore qui augmentent. Donc, c'est le temps actuellement de vraiment faire attention et ne pas voyager, et ne pas visiter des places si ce n'est pas nécessaire.
Great. Thanks, Dr. Paul. We're going to go to a question that we received right before our Facebook Live went live.
Mhm.
And so this question is from Sheena Stoka, and it talks about like the particular situation of having a 3-4 split class. So she wants to know why the medical officers of health are recommending that all students in a grade 3-4 split class wear masks or face coverings. But yet in their school board, it appears that only the grade 4s in the 3-4 splits are having to wear a face mask or covering, while the 3s in their cohort are exempt. So they're just saying that this seems odd to have half the cohort with a face mask and the other half
Yeah.
without. So
Yeah.
just
Yeah.
some comments or clarification on that.
Yeah. Well, my colleagues and I agree that if you're going to have kids in grade 4 to wear masks all the time, they should be wearing masks all the time. And it would be a bit, so your choice would be to have grade 4s wear it and grade 3s not to wear it. We opted for everybody wearing it because then it just makes everybody the same in the class. That's the reason we did it. We are going to be speaking with our school boards for that. We thought that if grade 4s wear it, so the other choice would be for nobody to wear it, right? So we don't want that. So we opted for just having a uniform approach. Again, recognizing that younger kids may be more difficult, but that's the approach that we've taken. Donc, en français, la question est qu'on a des classes mixtes avec 3e et 4e année. La moitié de la classe doit porter les masques et les autres ne devront pas le porter. On a deux choix. Soit que aucune personne qui le porte, mais ou soit que le 4e année le porte et pas le 3e année, ou soit que tout le monde les porte. Nous, on préférons que tout le monde les porte dans ce contexte, comme ça, tout le monde sont parés dans la classe.
Great. So we're going to stick with the theme of masks right now. Our next question has to do with, they're asking about, there are several school boards now requiring masks for all students from kindergarten to grade 12. And they're asking, is this something that the EOHU and our partner health unit, Leeds Grenville Lanark, would we ever consider going this route at some point?
Actually, we have thought about it. I can tell you that myself and my 6 colleagues all the way to Belleville had a consensus that we do not feel that compulsory masking would be appropriate for children in grade 3 and below. There are a variety of reasons for that. The Public Health Association of the Public Health Agency of Canada recommends masks for kids for 10 and over, which are around grade 4. We know that younger kids shed the virus less. It's the older ones that do it. And we know that there's a variability and ability to wear a mask, maintain a mask for prolonged periods of times, particularly in younger children. And as a pediatrician, I can tell you there's a wide variability in the dexterity and developmental readiness of children and wearing them properly. So we have actually recommended, all 6 of us, that at this point, we do not want to force children to wear masks. However, if they can and they can tolerate them, we certainly would support that. Donc, la question, c'est qu'on a les masques mandatoires pour les enfants en 4e année et plus, mais il y a certains conseils scolaires à travers l'Ontario qui obligent tous les enfants, même maternels, etc., de porter les masques. Et si on avait l'intention à l'implémenter chez nous aussi ou des autres bureaux de santé de proches, je peux vous dire que moi et 5 autres confrères, les 6 médecins hygiénistes d'ici à Belleville, on est tous d'accord que ça reste obligatoire aux 4e année et plus et recommandé pour les enfants qui peuvent le porter. La raison pour laquelle, il y a plusieurs raisons. Premièrement, l'Association mondiale, l'Agence de santé publique Canada recommande la porte des masques à l'école pour les enfants à plus que 10 ans, soit à peu près le 4e année. Deuxièmement, les petits enfants, les enfants en bas de 10 ans, ils propagent le virus de façon beaucoup moins que les adolescents, etc. Et finalement, il y a une variabilité importante au niveau de la capacité, l'habilité, la dextérité au niveau de porte des masques, de pouvoir tolérer les masques pour toute la journée sans les toucher, etc., chez les jeunes enfants. qui peut-être n'auront pas la capacité de le mettre ou de l'enlever eux-mêmes. Les enfants ont des développements développementaux différents, des différents stages. Ils n'ont pas tous le même étape, dépendamment de l'âge. Et c'est pour cette raison que nous obligerons pas les enfants aux troisième année et plus bas de porter les masques. Par contre, si l'enfant le tolère, on le recommande fortement.
Hi. Okay.
Hi.
Thanks, Dr. Paul. Lots of chatter going on in the live comment box. We have a question that came in right before our live session from Stephanie Eliza. Now, this kind of goes back to some of the information that was included in the ministry documents. And so she asked, what does the ministry mean by surveillance testing of asymptomatic secondary students at school? Does that mean that students without symptoms will still be tested? And if so, will parents be able to opt out of this testing?
Okay, first of all, that was a recommendation that we as medical officers of health do not agree with. And we are discussing at the provincial level. As a matter of fact, I sit on the newly formed education table with the Ministry of Education, Ministry of Health provincially to oversee all testing, surveillance, readiness, and those type of things. And I can tell you that our colleagues do not want to do that. That just means that we would test people to see if by chance they have what the rate of infection is in those areas. And it's impractical to do that at this point because we have 2 million students in Ontario, probably 1 million high school students, or really a higher number. You can't do that. However, there may be situations where we would have to go in and test certain children or test others because of surveillance reasons, specific reasons. So for example, there's an outbreak there or other things. So at this point, we have not received any mandates or requests to do that. And obviously, if we would, there would be an explanation for it. But it's impossible and impractical to test all high school students. Like I said, we do reserve the right to do it if we need to investigate something. So we may go and test a class, because potential contact or something like that. We want to get an idea, but there has to be a public health reason for that. So at this point, it's in the document, but it's something that we're not going to be implementing unless it's necessary for specific situations. La question était plutôt que le ministère de l'Éducation a ils vont faire dépistage des tests des enfants asymptomatiques pour la surveillance aux écoles à travers l'Ontario. Et je peux vous dire que les médecins hygiénistes, moi personnellement, on n'est pas d'accord avec ça parce que premièrement, c'est une pratique de tester tous les enfants à l'école secondaire. On parle de presque 1 million d'enfants. Et deuxièmement, ça pourrait être fait, mais dans un contexte où on aurait besoin de savoir, OK, est-ce qu'on a des enfants qui sont malades? Parce que peut-être il y a une raison pour laquelle on a un cas ou quelques cas dans la classe, on voudrait tester toute la classe ou certaines classes dans ça. Ça, c'est une histoire complètement différente. Donc, pour le moment, on n'a pas des plans de le faire, sauf si on a des raisons spécifiques pour une école ou une classe ou un groupe des classes lesquelles on pourrait tester. Et finalement, si un parent ne veut pas qu'on fasse le test, évidemment, on ne va pas le faire. Again, if parents have a right to refuse it, and we will respect that. But like I said, at this point, we want to do it where there's a real public health reason.
Great, thank you. We're going to go back to the comment box. Again, has to do with masks, but a little bit different. We're shifting to wearing a mask during gym class. And Kim Sove is asking, do students need to wear their mask while in the gym? And is it safe to wear them while exercising?
Okay. First of all, when we did our directive for the public, for our masks in Eastern Ontario and across, our 4 health units, the exemptions were obviously remove them when exercising. And it's the same with kids. So they would remove the mask when exercising, but that means that the teachers and the gym teachers must ensure that the kids are physically distancing at that point. La question était, est-ce que les enfants, pendant l'éducation physique ou l'activité physique, doivent continuer à porter les masques? La réponse est que nous, quand on a fait le directif en général pour tous les bureaux de santé dans l'Est d'Ontario, en effet, une exception était d'enlever le port des masques lors que vous faites l'exercice. Et à ce moment-là, c'est la même chose. Les enfants pourront enlever le masque quand ils vont à l'éducation physique. Bien sûr, il faut respecter la distance physique.
Great, thank you. We're going to go to a question that came from last week's chat that was left unanswered. And so the individual was asking, if there is a member of their household who is high risk, would you recommend that they opt for remote learning as opposed to online learning? In-person learning?
Well, that is a very good question, and it's a question that depends on the individual situation. My feeling would be that children at this point, it's very low risk that they'll bring it home. However, in the situation that they would bring it home, if it is an option at this point, perhaps or two things. Either the child can go to school, but that individual who has medical conditions or has vulnerabilities is self-isolates from that child, distance and eats in another room and those type of things. Or you need to contemplate, again, depending on the severity of the illness and in discussion with the physician, perhaps remote learning. So those are the options that you'd have. Again, I can't talk about the individual ones, but like I said, what we're trying to do is we're trying to mitigate as much as possible spread within the schools. But again, that would have to be weighed and measured according to the medical situation and perhaps ability to isolate from that vulnerable individual at home. But those, again, that's a individualized decision. La question est que si on a une personne vulnérable à la maison, est-ce qu'on est mieux que les enfants restent à la maison et suivent les cours en ligne? La réponse, c'est un peu compliqué. Premièrement, on essaie le mieux possible de ne pas avoir le virus à l'école. Par contre, ça dépend de la sévérité du personne à la maison, vulnérable. On a deux choix. Soit que l'enfant pourrait aller à l'école, mais de ne pas être en contact proche avec cette personne vulnérable. Des fois, ça peut être pratique, ça ne peut pas être pratique, dépendamment de cas. Ou que l'enfant reste à la maison et prend les cours en ligne. La décision est plutôt une décision individuelle qui devrait être faite avec la consultation du médecin de personnes aînées ou de personnes vulnérables pour voir la meilleure situation individualisée.
Thank you. So we're going to go back to the comment box and back to school transportation, but this is more tied to contact tracing. So Heather Buist asks, can you give an example of what contact tracing will happen if a child riding the bus with two other schools gets a positive test? Would every child on the bus and their family need to quarantine? And would that extend to all the cohorts in their classrooms in all three schools?
No. First of all, if it was one child that was infected, that's what we're talking about, right? One child, the contact tracing. So this was one child that was in the bus. We would have two cohorts. One, we would look at the classroom and look at how close that child was, masking and so on, vis-a-vis the others, and identify the ones that were at high risk. It's not necessarily the whole class. That's one cohort. And the other one would be, of course, looking at the bus. That's why we'd have the list. We'd know who the child sat with, where the child sat, and we have 2 meter distances. And then those children would then be contacted and their families would be contacted as well. But it doesn't mean that we're going to isolate the parents. We're just going to tell those families of the contacts will be asked to self-monitor, and we're not necessarily going to test all children. But again, it depends on the situation. So yes, so the tracing will occur. Okay, this child is positive. Who was in the bus? Who was around them, what the risk factors are, then we contact them and their families, obviously, and the same goes for the classroom as well. So, la question est que si un enfant est malade, le fait qu'on prend ou a du COVID, par exemple, et on veut faire le tracé, si un enfant a une classe et puis après ça, il va dans un autobus avec plusieurs autres enfants des autres écoles, comment est-ce qu'on va faire le tracé? Premièrement, on va commencer par la classe. On va voir exactement si l'enfant portait les masques, si tout le monde portait les masques, on va évaluer le risque et on va identifier les personnes qui étaient autour de cet enfant et de voir, OK, ces 3 ou 4 personnes devraient être testées, devraient être isolées, etc. La famille de personnes en contact, les enfants en contact, devraient juste suivre les symptômes, ne devraient pas être isolés. Mais la question arrive, qu'est-ce qu'on fait avec l'autobus? À ce moment-là, nous avons une liste, nous savons exactement qui s'assoit avec qui et nous allons faire un périmètre de probablement 2 mètres autour des sièges. Donc, ça peut être 6, 8 enfants. Et ces enfants, encore, on va voir est-ce qu'ils portent des masques, c'est quoi le contexte du contact, etc. Et on va contacter leur famille aussi, n'importe quelle école qu'ils vont, pour vérifier que les enfants étaient en contact et avec quelles précautions on va recommander, soit isoler, soit tester les enfants. Le restant de famille, des contacts de l'enfant, pas l'enfant même, des contacts de l'enfant vont être demandés vraiment de faire une auto-évaluation de leurs symptômes, mais pas nécessairement d'être isolés.
Great, fantastic, Dr. Paul. I just want to take a moment to remind all of the folks on the line that today we're on part 2 of talking about back to school. And so we're going to try to get to as many questions as we can. If your question has to do with something outside of schools, we may not answer it right now on the live session, but we will try to make sure that someone responds to you shortly, so over the next couple of days. Donc, juste un rappel pour ceux qui sont sur la ligne, la session ce soir, on discute du retour à l'école. Donc, si votre question pertine à un sujet qui est un peu hors de la discussion, ne vous inquiétez pas, on va s'assurer qu'il y a quelqu'un qui va faire le suivi avec vous prochainement. I'd also like to encourage folks to go and check out our website, so eohu.ca /coronavirus. You'll be able to find all sorts of information related to COVID-19, but also specifically related to schools. There's an entire section, and there's also a frequently asked questions section. So a lot of the answers that Dr. Paul is providing today, right now, you can actually go and find them on there, and we'll post a link to that website after the live session. Donc, on aimerait aussi encourager les gens d'aller visiter notre site web www.bseo.ca. On a une section sur COVID et aussi une section spécifiquement pour les écoles. Puis la majorité des questions que Dr. Paul répond aujourd'hui, on a de l'information sur notre site web qui permet d'avoir les réponses à ces questions. So just shifting gears a little bit, because I think there's been a lot of discussion about what we're doing right now, because we're in the pandemic, we're still in an emergency phase, but we have Chantal Laverne in the comment box who asked a question I think that's very relevant because we're going on 6 months now of being in this mode. And so she's asking a little bit about whether or not there's been some long-term discussion of how we can live moving forward, knowing that COVID is basically here to stay. And I'm paraphrasing a little bit. Knowing that a vaccine may not necessarily end this pandemic because it's a virus, it can change. And so she says, it feels like we hear nothing about how we're going to learn to live with this virus, how we're going to protect the vulnerable, while also accepting that we're going to be having cases like many other diseases. So just kind of wondering if you have some thoughts on that.
Very good questions. Of course, yes, we're into 7th month now of COVID, and it has definitely disrupted all of society. It has wreaked havoc on businesses. It has wreaked havoc on our socializing. It has wreaked havoc on our vulnerable populations, particularly long-term care facilities, and obviously disrupted schools. No schools since March, and just going back now in a completely different world, seemingly. And so I do understand the question. I also understand the frustration which we all feel. I'm tired too. We're all tired of this. However, I do think that there needs to be a longer term approach, which is essential, which is what the reality right now. Having to live with it, having to live with social distancing, having to live with understanding that we're always at the risk of the virus. And I am optimistic that a vaccine will help us. will help at some point, fight this pandemic. The more people that are immune to the virus, the less the virus can circulate. And as such, that will be the time where the pandemic ends. I don't think we're in the pandemic for many, many years, but certainly we're going to be into this until next year, early next year or middle of next year, until we have a vaccine. So I'm optimistic that a vaccine will help us, but in the interim, you're right. We have to learn to live in this reality, both in terms of ensuring that we find other ways to socialize with people that we can't see or that we ordinarily would, and then take care of our children, their mental health, and we'll talk about that at the end of this as well in terms of the mental health impact on this. And obviously, we need to refresh our economy. We've learned some lessons from this. I know that a lot of businesses and a lot of people prefer working at home. So there are some good that's come out of this because they now can balance more work-life balance. But I'm optimistic that moving forward next year with a vaccine coming out, this virus does not seem to be mutating. It's not the same as the flu. Does not seem to be mutating. I think that we'll be able to offset this pandemic again progressively with a vaccine. The more people we vaccinate and the more people that get infected. Now, I'm not suggesting that people get infected, but like I said, as we get the immunity up, hopefully done by a vaccine, we will be seeing decreased cases and more people being able to go out and start going back to normal. But it's going to be a long haul, not years, but I think up until next year for sure. And again, I can't predict it, but the more we buckle down right now, the better it is going to be for us in terms of not having to go back and close businesses and close schools and have as normal as life as possible moving forward. Je vais donner un sommaire en français. La question était plutôt, étant donné qu'on va avoir la pandémie ici à long terme, est-ce qu'on a les plans pour comment on va commencer à être habitué à cette nouvelle façon de vivre avec COVID, semble-t-il, pour des années, parce que peut-être un vaccin ne va pas guérir ou ne va pas cesser la pandémie. À mon avis, c'est sûr, certain qu'on a eu vraiment un changement important, déroulement important de notre vie quotidienne, les enfants, les écoles, l'économie, la façon de travail, la restriction de rassemblement, etc. Tout ça, c'est sûr et certain que c'est fatigant et c'est pas normal, on n'est pas habitué. Là, on est dans un stade qu'on commence à rouvrir un peu, rouvrir les écoles, mais on est encore dans une pandémie. Et moi, je suis optimiste, par contre, qu'avec un vaccin, on va assurer qu'il va y avoir beaucoup de gens qui vont être immunisés. À ce moment-là, ils vont résister, le virus ne va pas les infecter. Donc, le plus que les personnes sont protégées, le moins que le virus va se propager. Et à ce moment-là, c'est là que la pandémie va commencer à s'en aller. Je ne pense pas que ça va prendre des années, mais je pense si ça va surtout l'année prochaine, espérons qu'on va avoir un vaccin avec l'arrivée d'un vaccin, avec une distribution de vaccins à travers la plupart de la population qui pourrait l'avoir. Le plus haut le chiffre que ce soit qui va être vacciné, le plus vite que la pandémie va s'en aller. Mais c'est sûr qu'entre-temps, il faut faire attention et trouver des moyens à maintenir nos santé mentales, surtout avec nos enfants aussi, je vais en parler tantôt, et aussi de trouver des façons qu'on pourrait s'amuser, de nouvelles façons. C'est vraiment changement important, drastique qu'on avait.
Great. Thank you, Dr. Paul. So we're going to go back to the comment box and it touches on the question, this idea of a vaccine coming soon. And so Angèle Thompson asks, will vaccines be mandatory?
I don't think that the vaccines will be mandatory. I don't think that at this point we're contemplating on vaccines being mandatory. Will they be strongly recommended? Of course. Will I get the vaccine? Of course. Will my family get the vaccine? Yes. So I do believe that the more people that are vaccinated, the quicker the pandemic will go away. So I don't believe in mandating vaccines, but I do strongly recommend that the vaccine, that people get the vaccine. Obviously, we're going to be prioritizing initially the vulnerable first responders, those type of things. But I would highly recommend it, and I would not envision at this point in time that it's a mandatory thing. La question est, est-ce que quand le vaccin de COVID va arriver, est-ce que ça va être mandatoire? À mon avis, je ne crois pas que ça va être mandatoire. En effet, je vais le recommander fortement à tout le monde de soit vacciné. Moi, je vais le prendre. Mes enfants vont le prendre. Ma famille va être vaccinée. Parce que le plus les personnes qui sont vaccinées, le plus rapidement que la pandémie va s'en aller. Mais c'est sûr qu'à ce moment-là, on n'a aucun plan de faire le vaccin mandatoire.
Great. Thanks, Dr. Paul. We've got about 10 minutes left, and so I'm going to go back to a question that was asked last week that we didn't get to. Back to the classroom. And so someone's asking, are plexiglass partitions at children's desks, whether they be standalone desks or rounded tables that seat 3 to 4 children, sufficient in providing protection to children in kindergarten to grade 3 where masks are not mandatory?
The answer is yes. It would be. As a matter of fact, we've recommended that for certain classes, special ed classes in one of the French school boards, that kids are sitting together at a table and they can't physically distance because of issues. And so, yes, a plexiglass is an alternative to masking. As a matter of fact, this is what we use in stores. People who are behind a mask are safe, and actually vice versa. They're not spreading it to others. So yes, ideally, and we've seen it in other countries where they've actually surrounded kids with plexiglass. Again, it's costly. It's maybe a bit limiting for children, but a plexiglass is an acceptable alternative. But again, it depends on the context. And like I said, there are some classes where I've already spoken to the principal, the director, where they can't physically distance them. It's just because it's the nature. They have special needs, the children. At that point in time, if they do a plexiglass between the two kids, at least and these kids can't wear masks, even if they're older children, can't wear masks. In that situation, it may be useful. So those are individualized situations that we'd be looking at. La question est que si dans une classe, les enfants portent pas de masque et on ne peut pas garantir une distance physique, surtout quand on a 2-3 enfants sur une table, est-ce que le plexiglas pourrait être utile? La réponse est oui. On le voit dans plusieurs autres pays. C'est une question de si c'est pratique ou pas, si c'est quoi le coût, etc. Par contre, j'ai déjà recommandé le plexiglas dans une classe spéciale avec des enfants avec des besoins spéciaux qui ne pourront pas porter de masque et qui ne pourront pas vraiment. Ils travaillent dans une table ensemble, c'est la façon qu'ils apprennent. À ce moment-là, en mettant les plexiglas entre les enfants, va les protéger.
Great. So I'd like to take a bit of time because we've spent a lot of time talking about what measures we're all taking to ensure a safe return to school. And we know that going back to school can be a difficult transition for students at the best of times, but especially this year with the pandemic shifting the way we normally do things. Also, today happens to be World Suicide Prevention Day. And so I wondered if you could take a bit of time to talk to us about if there's anything being done to support the mental health and well-being of students, and whether there are any resources to help parents, teachers, or caregivers.
Yes. Well, first of all, yes, today is World Suicide Prevention Day, and it speaks to mental health issues, and we touched a bit about it before. And there are concerns about everybody's mental health, and particularly young children. As I talked before, they're not socializing with others and those type of things. And so I think it's important for us to be aware of that. We do have resources through the Champlain East Suicide Prevention Coalition, which really there are several websites, in terms of reachoutnow.ca, for example, for suicide prevention, and there are a whole slew of resources about that, about making sure that we see the signs of suicide, but in general, but more broadly, obviously, just looking at the mental health of our kids, the Champlain East United Way SDG, there's training sessions for people, and there'll be some we could put some of the links on our Facebook And so we'll ask you to share them and remind people that, again, we need to take advantage, not advantage, we need to be aware of the mental health of kids. And again, in particular today, there is we're highlighting suicide as it is World Suicide Prevention Day. You can get some information on websites, iasp.info, but we will put it on our Facebook, so you can get more links to that. Donc, en français, c'est très important. J'ai parlé tantôt avec l'effet de santé mentale, l'effet sur la santé mentale du COVID. Et en effet, aujourd'hui, c'est la Journée mondiale de la prévention du suicide. Donc, c'est un bon temps de penser aussi, surtout quand on parle des enfants, on parle de santé mentale des enfants aussi. C'est très important de ne pas oublier cet aspect, cet effet du COVID qui est non infectieux, mais assez importante aussi. Nous avons plusieurs ressources sur nos sites web, plusieurs ressources qu'on pourrait vous mettre sur nos Facebook au niveau des différentes ressources pour en parler, en penser pour nos enfants et pour aider le soutien de tout le monde, surtout les enfants, pendant cette période qui, je pense, tout le monde est d'accord que c'est une période, je pense, qui est un défi très important aux enfants, aux jeunes enfants, adolescents, etc. En effet, on a déjà, surtout les adolescents, on a déjà un taux de problèmes mentaux, de santé mentale augmenté. Et c'est naturel à penser que vraiment la pandémie va empirer la situation. So again, we really have to be thinking about the mental health of our children, looking at ways that we can stimulate them, that we can talk to them and support them. And the other thing too is we need to be sitting down with our kids and talking to them about not only how they feel about it, the anxieties and so on, but also, why we're doing this. Why is the teacher wearing a mask? Why is he wearing a mask? Why is that person doing that? Why is that person behind a glass? We need to explore why is it important. So we start all that so we can get them used to that new reality. But kids are very resilient. But as long as we're very aware of what we need to do is to support these children. Donc, les enfants sont très résilients. Il s'agit de vraiment prendre le temps de parler avec l'enfant, être ouverte avec les enfants, parler avec leurs angoisses, si c'est que les préoccupations, les phobies ou toutes sortes de préoccupations que les enfants ont, ce n'est pas un temps normal. Parler le plus possible aussi au niveau de le soutien de santé mentale, mais parlez-en. Pourquoi le professeur porte un masque? Pourquoi est-ce qu'on devrait porter les masques? C'est quoi le COVID? Pourquoi? Il faut l'expliquer, il faut démystifier, mais je pense que les enfants sont résilients tant qu'on donne le soutien et reconnaître que les enfants devraient être stimulés, devraient être écoutés. Il faut avoir une oreille ouverte et de voir pour les signes si l'enfant est déprimé, etc. Donc, on a des ressources pour vous et c'est vraiment le temps à penser à ça. Ça tombe que c'est une journée de suicide mondial, mais ce n'est pas juste aujourd'hui qu'il faut en penser. Il faut en penser tous les jours de assurer les enfants. Donc, today is Suicide Prevention Day. However, it's every day that we need to be thinking about mental health, not only ourselves and our families, but particularly our children who are going through unprecedented times as we are. So we need to support them.
Thank you, Dr. Paul. So we've posted a number of links in the comment box. Just want to direct everyone to a specific link. It's ridethewave.ca, portéparlesvagues.ca. So this is a really great campaign that you'll probably be seeing more frequently, and it's all about how to tackle mental health and well-being, and also kind of tackling some of the issues that kids may be facing right now because of the pandemic. Donc, un bon site web, plein de ressources pour les parents et des astuces pour les élèves qui cherchent de l'info sur comment naviguer cette période difficile, surtout pendant une période de pandémie. And with that, Dr. Paul, we are at 7:28. So thank you everyone for joining us. And thank you, Dr. Paul, for taking the time to answer lots of questions. Donc, merci à tous de vous joindre à nous ce soir et merci à Dr. Paul qui a pris le temps de répondre à plusieurs questions. A recording of the event will be posted on our Facebook, YouTube, and on our website. Donc, un enregistrement de la présentation sera publié sur notre Facebook, YouTube et notre site web. We're encouraging folks, if you still have some questions, you can always contact us at the health unit. You can send us a message. You can call us, 1-800-86, oh my gosh. I think I would know that off the top.
1-800-267-7120.
Thank you.
1-800-267-7120.
Thank you, Dr. Paul. Donc, si vous avez des questions, vous pouvez nous envoyer des messages par notre page Facebook. Vous pouvez communiquer avec nous 1-800-267-7120. On fait notre possible pour répondre à vos questions. So we'll do our best to answer your questions. And thank you. Have a good evening. Bonne soirée.